would like to talk this afternoon about the healthcare history of South Dakota. It didn't just start with Obamacare. We have had basically what I call a bureaucrat-controlled healthcare ever since the early 1990s. It started actually with Hillary Care. If you remember back then, Hillary Care was an attempt to take over the healthcare at that time, but it failed. However, South Dakota, with our Senator Tom Daschle, recall he was very involved in the Hillary Care. Daschle and Janklow both kind of started a government-controlled healthcare situation. And then when Governor Rounds and Lieutenant Governor Dugard came to power, they further encouraged government-controlled healthcare. In 2007, their department wrote 3 bills. One was for an individual mandate, meaning that you had to buy health insurance or you could be put in jail. That is on the state website. Another one was for very government-controlled healthcare exchange. Back in 2007, they wanted a healthcare exchange. Those 2, thankfully, were killed in committee. However, after they were killed, they hog-housed an empty shell of a bill, and they put in the Zanaya Project. The Zanaya Project is a whole project where Governor Rounds said about this: the Zanaya Project is a commitment, not an exercise in theory. What they're trying to do is input healthcare, government-controlled healthcare, into policy, not necessarily legislative control. A lot of our healthcare bills have been, Obamacare bills have been written by the departments. We have, in our situation, we are different than other states. We are basically putting in Obamacare through policy, not through legislation. It is confusing a lot of different think tanks that are wondering where South Dakota is on this issue. We are putting Obamacare in through policy, not legislation.